I don't think it's a matter of authorities here. I think there is something general about the working condition in these meat processing plants, right? You have this huge plant that you mentioned in North Rhine-Westphalia. You have another one in Germany with a new outbreak, but you have the same thing in different countries like in England, in the US. There's something about these meat processing plants that seems to give optimal conditions for viral spread. And the important thing now, coming back to what government authorities can do, the important thing is to try and contain this outbreak and prevent it from entering the general population and make it unstoppable. So if all works well with the lockdown, you can discuss if it should have come a day or two earlier than it did, then it may be contained, but that's the real important thing now, to just contain it and prevent it from spreading into the general population.
Is the R rate now at or near 3? That's what we were reporting on several days ago here, but if it is at that level, would that suggest there's also been a failure around testing and perhaps any contact tracing efforts?
Yes and no. So the number is around 3. It's 2.88 or something like that by late yesterday. But as far as we can see currently from the reported cases, this is completely or almost completely due to these hotspots. So to the meat processing factory and 1 or 2 apartment blocks in Göttingen. So thus far in most counties, there's very few or even no new cases. So currently it's very localized, and the important thing is to keep it like that and prevent it from further spreading.
If I can broaden the conversation out a little bit, yesterday we heard from the top infectious disease expert in the United States, Dr. Fauci. He weighed in saying he's cautiously optimistic that a vaccine may be ready by the end of this year. What do you think?
That is very optimistic, but I think the other date that you mentioned is by the middle of next year is still optimistic, but maybe a little bit more realistic. It depends on how you define available. If it's tested and approved, this is definitely much faster than really available for mass distribution, where you need to build up production facilities and all that. So I still think if we had a vaccine by next summer, this would be very lucky.
And when you think about the people who are most vulnerable to this disease, the elderly, of course, are one of the biggest groups. Do we have any idea how the elderly are going to react to getting immunized once a vaccine is available?
Of course we can't know, but we can speculate from current experience with other vaccines. And the immune system in the elderly tends to react less vigorously to new exposure than a younger immune system. So for several vaccines, including the flu vaccine, you need to immunize the elderly with higher doses than the younger. But that's a technical problem, I think, that can be solved.
And one of the big risks when we think about the evolution of a new virus is that it can mutate. Is this something that you're actively concerned about, that we may see a mutation of the virus perhaps before a vaccine is ready for broad distribution?
Not really. So people are constantly surveilling the virus and sequencing virus strains from different parts of the world. There's small mutations going on, obviously, but the coronavirus is very careful about its genetic material, and there's no huge mutations. There's nothing comparable to the flu, where you would need a new vaccine for every season. So it seems rather stable.